Coronavirus numbers are continuing to surge across the United States. According to Johns Hopkins University, more than 8.2 million Americans have tested positive for COVID-19 since the beginning of the pandemic, and now more than half of U.S. states are reporting an alarming rise in new infections. Let us bring in pediatrician Dr. Dyan Hes. She is the founder of Gramercy Pediatrics. Dr. Hes, we here in New York City were sort of early on as being the epicenter of the pandemic. Things have sort of flattened over the last couple of months where New York is doing very, very well. Are you seeing at all a surge in new cases and hospitalizations among your patients or in the New York City area?
Not in our immediate area. I'm downtown in New York City, and we're still testing kids on a regular basis, and still, knocking wood, not one positive COVID case. And we've tested, like, I would say 1,000 at least already. So it's pretty amazing. We've done a great job in New York City. People are taking it really seriously. We're seeing, like, in some of the schools, one case here, one case there, but no major outbreaks. They contain the classroom. They close it for, they quarantine those kids for 14 days. But we just haven't seen the outbreaks that people were saying are going to happen when you have schools open. It's exactly the opposite.
So let's talk a little bit about some of the studies, the new studies that have come out. A new Johns Hopkins University study suggests that older males who have recovered from COVID-19 are actually the best plasma donors for treatment of coronavirus. What do we know about that?
Well, that would make sense because, we don't know why males, but it's actually people who are hospitalized. So older male donors who are hospitalized. That means they had a really robust kind of battle against the virus, and their body had to churn out antibodies to survive, basically. So it kind of makes sense when you think about it. They're the patients who are going to have the highest antibody levels, because if you just had a mild cold and you didn't really end up in the hospital, or you just were sick for 2 days, your antibodies didn't have to work in overdrive to make, to fight the virus. I think it makes sense. We don't know why males are, at a greater risk. That's still to be determined, but it's not shocking to me.
So, Dr. Hes, the UK announced it would launch the world's first human challenge trials for COVID-19 by infecting healthy people with the virus in its efforts to find a new vaccine. What are your thoughts on how effective that could be?
I think it's amazing. I think it's brave. I think that it's really interesting because they're taking volunteers ages 18 to 30, and I think they already said, it said in the article, they have 38,000 volunteers already. Listen, when we're wearing masks and we are socially distanced, it's hard to catch COVID. This is what we've proven in New York City. So we have a vaccine on the market in a study. Well, not on the market. We have a vaccine in a study, but how do you test it in the world when everybody's wearing masks and you're not really getting exposed if you're doing a good job? So these are volunteers. They're doing it on an altruistic basis. They are not getting paid. They are not getting compensated. They are doing it for public health purposes. And they will be, if they do have a rough course, they will be eligible for remdesivir. They're going to be very closely followed by the scientists and doctors. I think it's amazing, and it could speed up the process of a vaccine by at least 3 months, I think.
So the Transportation Security Administration, the TSA, says that it screened more than 1 million passengers for the first time since March. I think this was at security checkpoints on Sunday. So this is an indication for them that more people are traveling than they have been, since this pandemic started. And this also comes as the Defense Department released a study suggesting that the coronavirus may not actually spread very well on an airplane. And we've heard that before, that there's a very good air filtering system on most commercial airplanes, and if people keep their masks on, that makes a huge difference. That being said, we are entering into the holiday season. People are going to want to travel. It's colder in much of the country, which means people are going to be indoors in a way that they have not been over the past few months. And of course, there's flu season. People are going to want to meet with loved ones and relatives, and they might think if I'm going to get on a plane, this is going to be the time to do it. This is when it's going to be worth it to travel. But do they have to consider sort of all these other things that are coming into play over the next few months?
I definitely think so. And you have to remember that study that they released was done with a mannequin who was spewing particles of the viral, suspected virus, and they were measuring the air around it. That doesn't take into account human behavior. So we know that you eat on an airplane. We know that you drink on an airplane. We know that people throw up on an airplane. So, there's a lot of, you use the bathroom. There's a lot of room for error in that study. But we do also know that there are people who are flying with their masks on and they are doing fine. I just, like, as a mom who's flown with kids who have like literally puked in my lap, or I'm a doctor taking care of people who are sick on an airplane, and it happens almost every time. I wouldn't say that that study is extremely accurate. I do say that, I personally would take a shorter flight. Like, I might not fly across country unless I had to for work or for family. I would make sure my kids are wearing masks and my family is wearing masks, maybe even a mask and a shield on an airplane because you protect your eyes, or goggles. But I don't think there's no risk. Yes, they do have air turnover, but I just think that there's too many variables to say that it's completely safe. But I think if you're a healthy person and you keep your mask on and you keep your goggles on or glasses, it should be okay.
One question, Dr. Hes, that I have, and this may be a dumb question, but sometimes I sort of feel like I'm the surrogate for like my family who's wondering about stuff like this. As it gets colder, one of the things that obviously is part of when things get colder is you can actually see people's breath, right? The condensation from their breath. I wonder what that will mean when you see somebody who's wearing a mask, and some of those masks, I'm guessing, you'll actually still see that those breath vapors. That'll be kind of scary, I think, for me at least. I wonder, will that mean anything? Does that mean anything, or is it just breath vapors, nothing to worry about?
No, I think you're absolutely right. That's a great analogy, because I didn't even think about that. But I can tell you that I ordered a whole bunch of face masks the other day online. Like one of these, they're like the cool face masks, so you could work out with them, and they absorb the sweat. And then when I put it on, like, it was getting sucked in and sucked out, sucked in and sucked out. And my son is like, that's not a good mask, because it's sucking in and out because you're breathing the air in and out. And, he's right. And I think that's a great visual that you're talking about. I think Bill Nye, the science guy, also tried to test different masks and blow candles out, and that's a really good judge. If you could blow a candle out with your mask on, then it's not a good mask. And the better the mask quality, you would have a more difficult time blowing the candle out. I think that's perfect to what you're saying. I'm thinking what you're saying. Imagine if we could put colors in that particles, that you saw it like spewing out like a neon or something. Like, I mean,
you see people walking around on the streets of New York, and there are some people wearing masks, some people not. For the most part, people are wearing them. But I just think that if you are walking down the street and you have a visual representation of people's breath, that would make it disconcerting.
It would give
back. Yeah, exactly. That's what I was thinking.
I think it's a really interesting observation. I think it's a good reminder that, when we talk about protection, it's sort of multiple layers of protection. It's not just the mask. It's also distance. It's also being outside. And, those masks are decent, but we all know they're sort of like loose on the top, kind of loose on the sides. They're not sealed around your nose and mouth. So, of course, there's air and stuff getting out. And so I think that is going to be sort of a wake-up call for a lot of people as the temperature drops, Vlad. That's really interesting. Dr. Hes, thank you as usual. Always love having you.
All right. See you next week. Bye-bye.